So we're here today with Jacinta, and she has agreed to have a chat with us about her bariatric journey, which we're really grateful for. She had her sleeve just about 3 years ago, just shy of 3 years, and she's just got some really interesting insights to share with us. So Jacinta, first of all, can you tell me a little bit more about sort of, I guess, what led you to this decision?
So I, like most people that are considering surgery, had been up and down with my weight for years. I'd had 2 kids, I'd had a marriage, I'd had a divorce, I'd had a lot of things happen. And I just couldn't seem to get on top of. I was also going through depression, and I found that I put on a lot of weight when I went on the medication for that. And I also have a family history of heart disease on my dad's side. He had a triple bypass at 51. And I just felt like that was where I was going if I didn't get control of my life, basically. So that's why I went down this road. I needed to get control and get back on top of it and start living.
Yeah, absolutely. And I'm sure that resonates with a lot of people out there as well. It's a really similar journey that we've heard through lots of our patients also. So tell me something that you wish you had have known, right at the start of this journey that you've now learned since embarking on the whole process.
I think for me it was how much it's a mental game. It's not the physical side of things. The surgery deals with that. That's fine. You have your ups and downs. You've got surgeons and nurses and dietitians and everyone to help you through that. But the mental side of it and that looking at, am I eating enough? Is it too much? What is somebody else eating? Am I doing the right things? And sort of having to deal with the changes and that sort of thing. It's just so different to what you expect. You're focused on the physical and the physical changes. You're not necessarily aware of the mental challenges that you're going to come up with.
Absolutely. And that again is often a really common area that is the biggest challenge for a lot of people. And so what has helped you through that? What are some of the mindset changes or shifts or I guess even methods that you've helped to make those mindset changes and shifts throughout your journey?
I think I've really engaged in the social media side of this. So there's lots of different groups. We've got our own group here that we have on Facebook and that, and there's other ones that I've joined. And being able to realise that every journey is so different. You can only control your journey and what you're doing and your experience, and not focusing on just food all the time as you go through it. Obviously initially that's all you're focused on. What am I eating? What am I doing? And you need to start focusing on the other things that happen. So changes in style in your clothing that you can go out and wear, and the things that you can do, being able to run around with my kids, go on holidays with them and do things. So I found just that shift in focus from being food focused to being lifestyle change focus, having something else to look at. So don't just focus on those scales, focus on everything that's changing, because there's so many things that you don't realize.
Absolutely. So it sounds like you've sort of really broadened your horizons of, I guess, what success and what change actually means to you. Is that right?
Yeah, exactly. I think initially everyone goes, oh, I'm going to be this size, or I'm going to be this weight, or I'm going to be, I want to lose this much. My body decided where I was going to stay. It got to a point and it said, yep, that's where I'm comfortable. So my focus then became, I can wear this, or I can do that, or I can this change, or that sort of thing. So it stopped being about the numbers and started being about the things that I can achieve. I run, and I've never in my life like those differences.
Yeah, so those sort of the non-scale victories, all those other bits and pieces. And you're right, because if we just focus on the eating and the weight, they're just sort of symptoms of other things that are happening in our lives, aren't they? So if we really start to focus on what's behind that, that really helps us sort of to move forward the journey. So you mentioned that you've been part of some of the online groups, as you say, the Facebook groups and things like that. And you've also engaged in things like the support groups and those sorts of things. Is that right?
Yes, so I actually engaged in the support groups, the online video chat ones, both pre and post-op. So pre-op, I guess I just wanted to find out those experiences and the differences, and I got to ask a few questions of people that have been through it. And then obviously in the earlier months as I came out of it, just to have that chat on where I'm sitting and how I'm feeling, and having other people's experiences and being able to go through that is really, really helpful. I like that engagement that we've got.
Yeah, great. And like you say, it's all about just meeting other people in your community, isn't it? Rather than that, oh, I'm comparing myself against this person's journey. It's still walking your own path, but knowing that you've got a nice community around you to support you as and when you need it as well. There's no such thing as a perfect bariatric journey. Everyone has their completely different pathways, and everyone has their ups and downs. But like you say, knowing that you've got people on your team to support you is really useful in those times. So, how would you say your view of surgery has changed as you've gone through as well? So like you say, you've had lots of mindset changes, but how do you actually, the view of surgery itself, how has that changed as you've gone through?
So I think in that pre-op stage and that early post-op, your view of surgery is it's everything. It's going to do everything. It's that perfect fix. While I understood that wasn't really reality, you kind of still think in your head that's going to be everything. But surgery really is that tool. It's that stepping stone. It gives you an opportunity to change your lifestyle and have a different focus and a different relationship with food. So it's the food is part of my life. It's not my whole life. I need to be aware of food, but I don't have to live focusing on that. Yeah. That one aspect.
And that's a huge change, really, isn't it? It's a huge shift to be able to go through. How long has that taken you? Because often, we can come through surgery, we've been thinking about it for months, if not years, before we have it. And so, we get that day out the hospital and think, right, I've changed. How long has it, I guess, to establish this new normal, this new way of viewing food and weight in your life going forward?
I think my change happened around 18 months after surgery. So for the first 12 months, especially, so many changes are going on in terms of what you can eat, how much you can eat and everything else. And once I got to that 18 months, both my weight and my food portion size had stabilised. I'd sort of worked out a few things. And so I felt like I could move into just living my life. And you're always going to have to be aware of your nutrition and your vitamins and all the rest of it. But it stopped being all about the surgery, and I just started living and going, oh, this is what everybody else sort of does. This is how they live. It's not that focus on my weight loss surgery, but I've really tried to be aware of things still. But yeah, it's just at that point where things sort of, I think, for me, and I was able to just live, and that's exactly why I had the surgery.
Yeah, and that's great to know. So 18 months is actually, a significant period of time after surgery, like you say, where you feel like it really settles down and gets into that new groove. So I think that's really important for people who are listening who might be maybe 6 months out thinking, oh, it's been 6 months. I feel like I should feel like she's telling me she is right now, but it can take a lot of time to actually get to that point, and quite a lot of work and back and forward with support people and other people in your community and things like that, can't it?
Yeah, it's definitely not. It's not you step out and you go, oh, I'm eating normal food again, and I'm back to that means I'm normal and everything's going to be exactly the way that I want it to be. It takes time. You're going to have steps forward and steps backwards, and you're going to need to reach out and ask for help, and all of those things are so normal. And it's okay if it takes longer to feel normal, but it's definitely not. It's not that quick fix, I think, that people think it's going to be. It takes time, and everybody just needs to learn that the way they're feeling and what they're going through is okay. And you will find that point where you feel like you're comfortable, and you probably won't even realize initially. I think it's more when you look back that you go, oh yeah, it was about then. But you don't necessarily notice things when you're going through it. It's more when you look back and go, oh yep, that was that point for me.
Oh wow, what an amazing journey so far. It sounds like you've done fantastically. And like you say, lots of reflection, and just lots of honesty with yourself. Like you said at the beginning, you sort of thought it was going to be a certain way, and then it's changed as you've gone through. And I think that's another big thing I'm hearing a lot when I'm talking to people is, just facing some of those maybe preconceived ideas, or some of those areas that are really scary. Even like you say, even asking for help can be scary, but when you get it, it can really help at various stages of the journey as well. So thank you so much for talking to us. Is there anything else that you'd like to add, or you feel like we've covered everything today?
I think we've covered most things. Just if you're thinking about it or you've been through it, you're not alone. It's okay to reach out for help. That's been something that I've been really valued with my choice in surgeon, is having that holistic support behind you from the start. Yeah,
fantastic. And even if you don't have a surgeon who has that support, then we're more than happy to help out as well. So thank you so much for chatting with us today. It's so valuable to hear everyone's experiences, and again, just to know that it's just nice to have someone that you can resonate with on the same journey as you. So thank you, we really appreciate it.
That's okay. Thank you.